Hello everyone, welcome back to my channel. So, in this video we will continue solving questions from chapter 1 of periodontics, that is gingiva and tooth supporting structures. We had done till question number 20 and now we will continue from question number 21. So, let's begin. So, question 1, normal depth of gingival sulcus in adult does not exceed option A 0.5 to 1 mm, option B 2 to 3 mm, option C 1 to 2 mm or option D 1 to 3 mm. So its answer is option B 2 to 3 mm. Its key explanation है that histologic sulcus depth versus clinical sulcus depth. The histologic depth of a sulcus does not need to be exactly equal to the depth of penetration of the probe. The so-called probing depth of a clinically normal gingival sulcus in humans is 2 to 3 mm. The depth of this sulcus as determined in histologic sections has been reported as 1.8 mm with variations from 0 to 6 mm. Other studies have reported 1.5 mm and 0.69 mm. Okay. Now question 22. Bacteria are populated most commonly on option A buccal surface, option B lingual surface, option C interproximal surface or option D occlusal surface. So its answer is option C interproximal surface. Explanation is most dental and periodontal diseases originate in interproximal areas because of accumulation of bacteria. Tooth destruction associated with periodontal disease often leaves large open spaces between teeth and long exposed root surfaces with anatomic concavities and furcations. These areas are both difficult for patients to clean and poorly accessible to the toothbrush. Patients need to understand that the purpose of interdental cleaning is to remove microbial plaque, not just dislodge food wedged between the teeth. So, the bacteria are populated most commonly on interproximal surface. Question 23. The function of Langerhans cells is option A melanin synthesis, option B protein synthesis, option C antigen presentation to neutrophils or option D antigen presentation to lymphocytes. So its answer is antigen presentation to lymphocytes. We have studied about it in question number 1. Now question 24. The main component of keratins in the stratum corneum is option A keratin polypeptide, option B K19 keratin polypeptide, option C K12 keratin polypeptide or option D K1 keratin polypeptide. So its answer is option D K1 keratin polypeptide or 68 Kd. Explanation है K1 polypeptide 68 Kd is the main component of the stratum corneum, while in basal cells the main keratin is K19, that is 40 Kd. Now question 25. Which periodontal fibers are consistent and are reconstructed even after the destruction of alveolar bone? So its answer is option D transeptal. Explanation is the connective tissue of the marginal gingiva is densely collagenous and it contains a prominent system of collagen fiber bundles called the gingival fibers. These fibers consist of type 1 collagen. The gingival fibers are arranged in 3 groups: gingivodental, circular and transeptal, which is classified sometimes as principal fibers of PDL. Now significance of transeptal fibers. They are considered as both gingival and periodontal ligament fibers. They are remarkably constant finding and are reconstructed even after the destruction of the alveolar bone. They form a dense firm covering over the bone which is seen after the removal of granulation tissue AP04 during the pocket eradication procedures. Now question 26. In periodontal ligament there is option A type 1 collagen, option B type 2 collagen, option C type 3 collagen or option D type 4 collagen. So the answer is option A, type 1 collagen. Explanation is the most important element of the periodontal ligament are the principal fibers. They are composed mainly of type 1 collagen. Type 3 collagen is present in reticular fibers and type 4 collagen is seen in basal lamina. So bone, gingiva and principal fibers of periodontal ligament are composed of type 1 collagen. We can learn it by 1. So there is also 1 bone में भी 1 आ रहा है एंड पेरिडोंटल में भी 1 आ रहा है. सो इससे हम याद कर सकते हैं. टाइप 2 कोलेजन is present in cartilage. Type 3 collagen, reticular fibers and granulation tissue. And type 4 collagen is present on the floor, that is basement membrane. Basement membrane is supplied by type 4 collagen. Note that the syndrome associated with a defect in type 4 collagen in basement membrane of renal glomeruli is Alport syndrome. The patient exhibits hematuria and renal diseases. Also note that cementum is rich in type 1 collagen fibers, and the main types of collagen in periodontal ligament are type 1 and type 3. Now question 27. Periodontal ligament is option A, narrower on mesial surface, option B, wider on mesial surface, option C, equal on both the surfaces, or option D, wider in the anterior teeth. So its answer is option A, narrower on the mesial surface. Narrow periodontal ligament is seen in the mesial surface of teeth due to physiological mesial migration. Teeth that are in hypofunction, that is teeth unilateral chewing habits, open bite, and whose antagonist has been lost, and at the fulcrum or axis of rotation of the tooth. In these regions, the periodontal ligament is narrower. So in single rooted tooth, the location of axis of rotation is the junction of middle and apical third of the root, and in multi-rooted tooth, the location of axis of rotation is in the bone between the roots. So in these areas, the periodontal ligament will be narrower. Now wider periodontal ligament is seen in trauma from occlusion, scleroderma and osteosarcoma. Now question 28. The periodontal ligament. Option A derives its blood supply primarily from the branches of vessels entering the pulp. Option B has a slow rate of turnover. Option C contains epithelial cells of Melissus, or option D comprises primarily of type 2 collagen. So its answer is option C, contains epithelial cells of Melissus. Epithelial rests of Melissus are the derivatives of Hertwig's epithelial root sheath, which may become cementicles or participate in the formation of periapical cyst and lateral root cyst. Periodontal ligament derives its blood supply from the apical vessels before entering the pulp, anastomosing vessels of the gingiva, and transalveolar vessels, transalveolar branches of intraseptal vessels. The vessels in the periodontal ligament form a net-like plexus which is closer to the bone than to the cementum. Periodontal ligament has high turnover rate of collagen. The rapid turnover rate of cells occurs more towards the side of bone. Question 29. The occurrence of keratinization in the human gingiva is option A, dependent upon the functional stimulation the attached gingiva receives. Option B, a reflection of inflammation in the underlying gingival connective tissue. Option C, a variable factor directly related to age. Option D, lacking in the gingival crevice. So its answer is option D, lacking in the gingival crevice or gingival sulcus. The sulcular epithelium lines the gingival sulcus. It is thin, non-keratinized, stratified squamous epithelium without craterpegs. Keratinization is inversely proportional to age and inflammation. That is why this is the wrong answer, which says it is directly proportional, and option D is the correct answer. Now question 30. What type of fibers are principal fibers of the PDL? So its answer is option C, collagenous. Collagenous fibers are the principal fibers of the PDL. Periodontal ligament consists of principal fibers and elastic fibers. Principal fibers are made up of collagen type 1. They are purely collagenous. Elastic fiber system is composed of oxytocin, elastin and elastin fibers. Although the periodontal ligament does not contain mature elastin, two immature forms are found: oxytocin and elastin. Oxytocin fibers run parallel to the root surface and are attached to the blood vessels, thus they regulate the vascular flow. So one more question is asked. PDL does not have. So the answer is mature elastic fibers. Now question 31. Periodontal fibers which are most resistant to forces along the long axis are. So its answer is option B, oblique fibers. The principal fibers of PDL are arranged in 6 groups: transseptal fibers, alveolar crest fibers, oblique fibers, horizontal fibers, apical fibers and interradicular fibers. So let's learn one by one about each. Transseptal fibers, they extend interproximally over the alveolar bone crest and are embedded in the cementum of adjacent teeth. They give interproximal support. This fiber group is also called as interdental ligament. They are reconstructed even after destruction of the alveolar bone resulting from periodontal diseases. These fibers may be considered as belonging to the gingiva because of no osseous attachment. Okay. Now alveolar crest fibers, they run from cementum just beneath the junctional epithelium in an apical direction to the alveolar crest. They prevent extrusion of the tooth and resist lateral tooth movements. The incision of these fibers during periodontal surgery does not increase tooth mobility unless significant attachment loss has occurred. Oblique fibers, they run from cementum to alveolar bone in coronal direction. They are highest in number, suspend the tooth and resist vertical masticatory stresses and transform them into tension on the alveolar bone. Horizontal fibers, they extend at right angle from cementum to the alveolar bone. Apical fibers, they arise from root ends and are absent in incompletely formed roots. They resist rotation of the teeth. Interradicular fibers, they fan out from the cementum to the tooth in the furcation areas of multi-rooted teeth. One more question is asked. Maximum number of fibers present in periodontal ligament. So its answer is option A, oblique fibers. Now question 32. The thixotropic theory claims that option A, the principal fibers of the periodontal ligament has the major responsibility in supporting the tooth and transmitting forces to the bone. Option B, the periodontal ligament has the rheologic behavior of a thixotropic gel. Option C, the displacement of the tooth is largely controlled by fluid movements. Or option D, none of the above. So the answer is option B. Thixotropic theory says that the periodontal ligament has the rheologic behavior of a thixotropic gel. Option A is tensional theory, which says that the principal fibers of the periodontal ligament has the major responsibility in supporting the tooth and transmitting forces to the bone. And option C is viscoelastic theory. The displacement of the tooth is largely controlled by fluid movements. Okay. Option A is tensional theory, option B is thixotropic theory, and option C is viscoelastic theory. Question 33. alveolar bone is? So its answer is option A, compact bone. Explanation is the alveolar process consists of an external plate of compact bone, inner socket wall of thin compact bone called alveolar bone proper, and cancellous or spongy trabecular bone in between these two compact bones. It acts as a supporting bone. So the alveolar bone is predominantly compact bone. Now question 34. Anatomic form of root of teeth is determined by option A, dental lamina, option B, neural crest cells, option C, Hertwig root sheath, or option D, hammock ligament. So its answer is option C, Hertwig root sheath. Anatomic form of roots of teeth is determined by Hertwig's root sheath. Question 35. Gingival sulcus is V-shaped and it barely permits the entrance of a option A, periodontal hoe, option B, periodontal curette, option C, periodontal probe, option D, periodontal sickle. So its answer is option C, periodontal probe. Gingival sulcus is a shallow V-shaped crevice around the tooth bounded by the surface of the tooth on one side and the epithelium lining the free margin of the gingiva on the other side. The clinical evaluation used to determine the depth of the gingival sulcus involves the introduction of periodontal probe and the estimation of the distance it penetrates. Now question 36. Which of the following are the predominant connective tissue cells of the periodontal ligament? Option A, cementoblast, option B, fibroblast, option C, osteoblast, option D, rests of Melisses. So its answer is option B, fibroblast. Fibroblasts perform the dual role of synthesizing new collagen and also degrading old collagen. Question 37. Indifferent fibers are option A, elastic fibers, option B, oxytocin fibers, option C, collagen fibers, option D, none of the above. So its answer is option C, collagen fibers. Indifferent fiber plexes are small collagen fibers which are associated with the larger principal collagen fibers running in all directions, forming a plexus. Question 38. With aging, changes in the periodontal ligament are option A, decrease in number of cells and increase in collagen fibers, option B, increase in number of cells and decrease in collagen fibers, option C, increase in number of elastic fibers, or option D, hyalinization changes. So its answer is option C, increase in number of elastic fibers. With aging, increase in elastic fibers occurs, whereas the number of fibroblasts and collagen fibers are decreased with aging. Another question is also asked, the number of fibroblasts in the PDL that decrease or increase with age. So the answer is it decreases with age. Now question 39. Function of the periodontal ligament. Option A, nutritive, option B, sensory, option C, formative, or option D, all. So its answer is all. Question 40. Feature of aging periodontium is option A, lacunae in bone and cementum, option B, increased cell size, option C, increased cell number, or option D, scalloping of cementum and alveolar bone surface. So its answer is option D, scalloping of cementum and alveolar bone surface. So effects of aging on the periodontium. Gingival epithelium, thinning and decreased keratinization, increase in epithelial permeability, flattening of retipegs, migration of junctional epithelium to a more apical position on the root surface, and width of attached gingiva increases. These are the changes, age changes of gingival epithelium. Now what are the age changes of connective tissue? Coarser and denser gingival connective tissues, collagen content increases, and rate of collagen synthesis decreases. Now on periodontal ligament, the age changes are number of fibroblasts decreases, decreased organic matrix production, and epithelial cell risks. On cementum, there is increase in cemental width, 5 to 10 times. Increase in width is greater apically and lingually. Accumulation of resorption base explains the finding of increasing surface regularity. On alveolar bone, more irregular periodontal surface of bone and less regular insertion of collagen fibers. Okay, so we have done 20 questions in this video, and the next questions will be solved in the next part of the video. So if you like this video, if it is helpful to you, then please do like and subscribe to this channel. Thank you so much.